everyone. I'm Laura Darling. I'm the Vice President of Communications and Spiritual Care for Covia. And today I'm very happy to be talking with Mary Lindy, who's the Executive Director at St. Paul's Towers. Hello, Mary.
Hey, how are you?
I'm great. It's good to see you.
Good to be here. Thanks, Laura.
All right. So I wanted to talk to you about visiting family, because I know that you recently had to do so. So could you tell me a little bit about what took you to visit family during this pandemic?
So here's what I'm going to tell you first, Laura, is I would not have done so if it wasn't a family emergency. I have a 92-year-old mom who fell and fractured her back, and she was in a situation where she lives in South Carolina that they would not put her into the hospital or a skilled rehab for short-term rehab because of COVID. And so there was just nobody there to care for her. I'm a nurse, and I knew from history that I could get home and I could spend 24 hours a day with her for a couple of weeks and get her tuned up a bit. So that's what took me home. But the first advice I would say is don't travel. Don't do it. If you don't need to do it, if there's not a family emergency, don't do it right now. We're in a global pandemic. And air travel is, you're flying in one big petri dish.
Yeah. So given that you were traveling in a petri dish, what did you do? How did you manage that?
So I packed things with me. So I was sure to, before I flew, to eat before I got on the plane, because I also am on chemotherapy and have some immunocompromise. So I didn't want to even take that mask off at all while I was on the plane. Number one, I flew first class, so I had some more separation between me and the people on the plane. Number two, I ate ahead of time so I wouldn't have to take my mask off during the flight. I wore an N95 fit tested mask. So I knew that not only was I protected from anything coming in, but people were protected from me. Prior to leaving, I had a COVID test, because I test every week because of my position. And while I flew, I kept that mask on the entire time. That's number one. I also carried with me disinfectant spray and disinfectant wipes. And even though the plane said they were disinfected, I cleaned everything as soon as I got in. I scrubbed down. They even had on the plane, they handed out disinfectant wipes to everybody, but it was one wipe. So I cleaned my whole area. And I just paid attention to what I was doing. I kept that mask on. I made sure it was fit. I couldn't smell things outside of the mask, or, just try to be prudent.
Yeah. All right. So when you arrived with your family, what did you do to keep your mother and everybody around you safe?
Well, I was less concerned about keeping her safe, because I knew that my test was negative, and I knew that what I was doing to protect myself. I was more concerned about being around her, because she had just been in a hospital. So I wore a mask. I have to admit that after the first 2 days of being with her, 24 hours a day, I went from the N95 to a surgical mask. But I kept a mask on, I would say, most of the time with her, and always if there were people in the house, and those people would be physical therapists or nurses or caregivers, or my sister and her children. But I wore a mask, and I kept clean. I got my mom her own bottle of disinfectant hand spray, and we washed hands a lot. And my mother, because of cognitive impairment, couldn't maintain a mask. We'd put it on her and she would take it off. But we just tried to maintain distance. We kept windows open where we could, and it was South Carolina, so there was ability to have air. And even when caregivers came into the house, if we had to sit and talk and be in space together, we went out to the screened-in porch and did that 6 feet away. Just tried to be prudent all the time.
So, all right. Well, that sounds kind of exhausting. So any advice for how to keep up the vigilance when you're in the middle of those kinds of situations?
Exhausting. And I was just talking here, we're very fortunate at St. Paul's Towers to not have had an outbreak. We've had 3 isolated cases that were found on testing. And part of that is this kind of vigilance, this diligence to staying with precautions. all I can say is it's a public health issue. It's not just my issue or your issue. When I come to work every day, I'm bringing the community I was just in, that I lived in, that I got gas at, wherever I grocery shopped at. I'm bringing all of those, those people's germs into this community. So when I come in here, I get screened every day. I wash my hands. I keep social distance. I always wear a mask properly. And, we keep our office doors shut. I have my mask next to me. So if anyone knocks on the door, the mask goes on quickly. And it does get old, right? But it also is becoming now second nature. And I think it's what we just have to learn to live with, especially until a vaccine is tested and distributed. We're going to be in this for a while. So even though the holidays are coming up, I know people are really anxious to go visit. CMS and our local governing agencies have put out guidance for visitation, helpful. But the interesting thing about that guidance is if you're going to be visiting with more than 2 people, 75% of your time needs to be outside. and windows need to be open to such an extent that you're going to be cold inside. Wear a coat, be 6 feet apart, wear a mask unless you're absolutely eating or drinking. And they're saying gatherings should be minimum like 4, 5, 6 people. Do people do that? I hope so. I really hope the best.
So when you came back from visiting your family, what did you do to help, again, keep this community, keep St. Paul safe?
So first, I quarantined for 2 weeks at home. So I worked remotely for 2 weeks at home. And when I first returned home, I came into work and I met my staff on the curb out in front of our building, and I had a swab test done. So I tested negative 2 weeks prior to coming back. And the day of my return, I tested negative again. So I did 2 negative tests before I returned to work. And I quarantined for 14 days.
Yeah. I know that you've made some recommendations earlier, but is there any summary statements, any recommendations as people are thinking about Thanksgiving, thinking about the holidays, thinking about the family that they miss? What do you have to say to folks?
The biggest thing is, and it sounds so glib to say it, but we have to stay the course. There will be Thanksgiving next year and the year after, and we can do things like this. We can do Zoom visits if we're able. Try to keep those in-person visits at a minimum and short duration, outside, with mask, with social distancing, with hand washing. Don't travel out of state. Don't travel by airplane if you can avoid it. And know that we need to treat this as a public health crisis, as it is, especially in communities like ours, because I have 250 residents and 180 staff that I'm bringing a potential virus to every day, and I have to think of it as not just my health issue, but a public health issue. And I rely on those other 400 or so people to do the same for me.
All right. Thank you so much, Mary. Thank you for sharing your story. And thank you for your advice. And I hope that you have a wonderful holiday.
Thanks, Laura. You too.
All righty. Thank you. Bye.